In this video, we will talk about the 24 symptoms of women's thyroid issues that cause infertility, balding, and even death. Did you know that thyroid issues can lead to balding? What's more shocking is that tons of women have it and don't even know their thyroid is the culprit. According to studies, thyroid disorders affect 1 in 8 women, and the symptoms can be severe if left untreated. Thyroid dysfunctions often go unnoticed until they cause irreversible damage. From weight gain to extreme fatigue, and from depression to heart failure, thyroid problems wreak havoc on the body. But what are the hidden causes behind these life-altering symptoms? Watch till the end of this video to discover the most surprising one. Below this video, click the white subscribe button and the thumbs up button, and then click the share arrow to share this to your Facebook and let others know about this information. Number 20, weight gain without explanation. Rachel, a 32-year-old marketing executive, noticed she was gaining weight rapidly, even though her diet and exercise routine hadn't changed. Despite working out regularly, the pounds kept creeping up. She later discovered that an underactive thyroid was the hidden cause of her unexplained weight gain. Weight gain without an obvious cause is a common symptom of hypothyroidism, a condition where the thyroid produces too little thyroid hormone. A study published in the Journal of Clinical Endocrinology and Metabolism found that thyroid hormone levels significantly influence metabolism, causing the body to store more fat when these hormones are low. Without sufficient thyroid hormone, metabolism slows down, leading to weight gain even if calorie intake remains consistent. Hypothyroidism affects about 5% of the general population, but studies show that Black and Hispanic women may face more difficulty receiving early diagnoses compared to white women. This delay in diagnosis can result in more severe symptoms, like unexplained weight gain, making awareness crucial. To manage weight gain caused by thyroid dysfunction, consider foods rich in iodine like seaweed or eggs to support thyroid health. Always consult a doctor before making dietary changes. But could this unexplained weight gain also lead to mood swings and depression? Number 19, mood swings and depression. Sarah, a 28-year-old graphic designer, began experiencing extreme mood swings and bouts of depression. She found herself feeling anxious one day and completely drained of energy the next. After months of confusion, her doctor finally diagnosed her with hypothyroidism, the root cause of her emotional instability. Thyroid hormones play a key role in regulating mood and mental health. According to a study in the American Journal of Psychiatry, low thyroid hormone levels, especially in hypothyroidism, can lead to chemical imbalances in the brain that contribute to mood swings, anxiety, and depression. Because the thyroid influences the brain's production of serotonin, the feel-good hormone, a deficiency can severely impact emotional well-being. Studies show that women of African descent are often less likely to receive mental health support for thyroid-related mood disorders compared to white women, with Black women facing more stigmas around mental health. This disparity can delay diagnosis and worsen symptoms over time. To manage thyroid-related mood swings, consider adding more selenium-rich foods, such as Brazil nuts and sunflower seeds, to your diet. Selenium helps support healthy thyroid function. But what about the constant fatigue that often comes with these thyroid issues? Could that also be related? Number 18, unexplained fatigue. Fatima, a 35-year-old teacher, found herself exhausted every day, even after a full night's rest. No matter how much she slept, the fatigue wouldn't go away. After visiting her doctor, she learned that her thyroid wasn't producing enough hormones, which was causing her body to slow down. Fatigue is one of the most common symptoms of hypothyroidism, as thyroid hormones regulate energy use in the body. When the thyroid is underactive, metabolism slows and energy levels drop. According to a study from The Lancet, over 60% of individuals with thyroid issues report constant fatigue that impacts daily life. This can make even simple tasks feel overwhelming. Women are 5 to 8 times more likely than men to develop thyroid issues, and fatigue is one of the primary symptoms. However, studies show that women of color, particularly Black and Hispanic women, are often diagnosed later than white women, leading to more severe and prolonged fatigue before receiving treatment. To combat thyroid-related fatigue, try drinking water infused with lemon or ginger to help increase energy levels naturally. Adequate hydration can also support metabolic function. But could this same thyroid issue be responsible for brittle hair and nails too? Number 17, brittle hair and nails. Tanya, a 40-year-old nurse, began to notice that her once thick hair was thinning and her nails became brittle, breaking easily. After consulting her doctor, she was diagnosed with hypothyroidism. The lack of thyroid hormone was disrupting the production of proteins, which affected her hair and nails. Hypothyroidism affects the body's ability to maintain healthy hair and nails because it slows down the metabolism, which in turn affects protein production. A study in the Journal of Endocrinology highlights that thyroid hormones are essential for hair follicle regeneration and nail strength. Without enough hormone production, hair becomes dry and brittle, and nails may crack or split. Women are more prone to brittle hair and nails caused by thyroid issues, and this is especially noticeable in African American women, who may experience slower hair growth rates compared to white women. Studies show that Black women tend to experience more severe hair thinning and breakage due to hypothyroidism than their white counterparts. To strengthen brittle hair and nails, try massaging your scalp with coconut oil or argan oil, which are known to nourish the scalp and promote hair growth. But what's behind memory loss and focus issues, often linked to thyroid conditions? Could they be connected to this brittle hair problem? Number 16, loss of memory and focus. Maria, a 36-year-old attorney, was known for her sharp memory and focus. But over time, she started forgetting small things, like names and appointments. Her concentration at work suffered too. After several visits to her doctor, she was diagnosed with hypothyroidism, which was the cause of her cognitive decline. Thyroid hormones play a critical role in brain function. Without enough of these hormones, cognitive processes like memory and focus can be impaired. According to a study published in Thyroid Research, individuals with hypothyroidism often report memory lapses, difficulty concentrating, and a general mental fog. This happens because low thyroid hormone levels slow down brain activity, impacting attention span and information retention. Women are far more likely to experience thyroid-related cognitive issues than men, with Hispanic women in particular experiencing later diagnoses, which can worsen symptoms like memory loss and mental clarity. Compared to white women, women of color are often underdiagnosed or misdiagnosed, leading to prolonged cognitive decline. To help manage memory and focus issues, consider adding more omega-3 rich foods to your diet, such as salmon or flax seeds, which are known to improve brain health. But could thyroid issues also be behind fertility struggles in women? Number 15, infertility struggles due to thyroid. Jasmine, a 33-year-old social worker, and her partner had been trying to conceive for over a year without success. Frustrated and anxious, Jasmine consulted a fertility specialist who discovered her thyroid was underactive, leading to her struggles with infertility. Hypothyroidism can interfere with the reproductive system by disrupting the balance of hormones necessary for ovulation and maintaining a pregnancy. A study from Fertility and Sterility revealed that women with thyroid disorders are more likely to experience difficulty conceiving and have a higher risk of miscarriage. Low thyroid hormone levels can cause irregular or missed periods, making it harder to predict ovulation. Black women are 40% more likely to experience infertility issues compared to white women. However, they are less likely to receive timely fertility treatment, and thyroid-related infertility is often overlooked. Thyroid disorders disproportionately affect fertility in Black women due to delayed diagnosis and limited access to specialized care. To support thyroid health and improve fertility, consider incorporating foods rich in zinc and selenium, such as pumpkin seeds and Brazil nuts, into your diet. But how does thyroid dysfunction contribute to balding and hair loss in women? Could it be connected to Jasmine's struggles as well? Number 14, balding and hair loss. Lauren, a 38-year-old hairstylist, noticed that her hair was thinning rapidly and even balding in some areas. After consulting her physician, she was diagnosed with hypothyroidism. The low thyroid hormone levels in her body were affecting her hair follicles, leading to excessive shedding and bald patches. Hair loss and balding are common symptoms of hypothyroidism. According to research from the International Journal of Trichology, the thyroid gland regulates hair growth by maintaining healthy hair follicles. When thyroid hormone production is low, hair enters the resting phase prematurely, causing thinning and, in severe cases, balding. This happens because the hair follicles become undernourished and weak, leading to faster hair loss. Women are more likely than men to experience thyroid-related hair loss, and Black women, in particular, may see more pronounced thinning and balding. Black hair is often more fragile and susceptible to breakage, which can exacerbate hair loss in women with thyroid disorders compared to white women, whose hair types may not experience the same degree of damage. To help minimize hair loss, consider massaging your scalp with rosemary oil, known for promoting hair growth and improving circulation to the scalp. But could muscle weakness and cramps also be a hidden symptom of thyroid dysfunction? Let's explore that next. Number 13, muscle weakness and cramps. Latoya, a 29-year-old fitness trainer, began to notice persistent muscle weakness and cramps, especially after workouts that used to be easy for her. After numerous tests, her doctor identified an underactive thyroid as the cause. The lack of thyroid hormone was leading to muscle fatigue and cramps, disrupting her ability to perform everyday tasks. Hypothyroidism reduces the body's ability to repair muscles and regulate calcium levels, which are essential for muscle contraction and strength. According to a study in the Journal of Clinical Endocrinology and Metabolism, thyroid hormones influence muscle function, and low hormone levels can cause muscle weakness, stiffness, and cramps. This happens because the muscles don't receive the necessary energy from the body's metabolic processes, leading to fatigue and strain. Women, especially Black women, are more prone to experiencing muscle weakness due to hypothyroidism. Compared to white women, Black women are more likely to suffer from severe cramps and muscle pain, often due to delayed diagnosis and treatment of thyroid conditions. This delay in diagnosis can lead to more pronounced muscle damage over time. To relieve muscle cramps and support muscle health, try adding magnesium-rich foods like spinach, almonds, and avocados to your diet. Magnesium helps regulate muscle function and reduce cramping. But could an irregular heartbeat or palpitations be another overlooked symptom of thyroid issues? Let's find out next. Number 12. Irregular heartbeat or palpitations. Monica, a 42-year-old administrative assistant, had been experiencing irregular heartbeats and occasional palpitations. Concerned, she visited her cardiologist, who found that her thyroid was underactive, leading to these unsettling symptoms. The lack of thyroid hormones was causing her heart to beat slower than usual, and at times, her heartbeat would become erratic. Hypothyroidism can lead to bradycardia, a slower than normal heart rate, or palpitations as the thyroid helps regulate heart function. A study in cardiovascular endocrinology and metabolism indicates that an underactive thyroid can cause the heart to pump less efficiently, leading to symptoms like irregular heartbeats, palpitations, and even heart failure if untreated. The thyroid hormone plays a crucial role in ensuring the heart muscles contract properly, and when these hormones are deficient, heart rhythms can be disrupted. Women are more prone to thyroid-related heart issues than men, and studies have shown that African American women are less likely to receive prompt treatment for hypothyroidism, which can delay necessary cardiovascular interventions. Compared to white women, Black women with thyroid disorders are at a higher risk of developing serious heart conditions due to delayed diagnoses. To help regulate heartbeat naturally, try consuming potassium-rich foods like bananas and sweet potatoes, which help balance electrolytes and support heart function. But what about dry skin and itching? Could they also be connected to thyroid dysfunction? Let's explore next. Number 11. Dry skin and itching. Keisha, a 37-year-old mother of two, noticed her skin becoming excessively dry and itchy, no matter how much moisturizer she used. After trying several skincare products without success, her doctor tested her thyroid function and diagnosed her with hypothyroidism. The lack of thyroid hormones was affecting her skin's ability to retain moisture. Dry skin is a common symptom of hypothyroidism because low thyroid hormone levels slow down the body's metabolism. This, in turn, reduces the amount of moisture in the skin, leading to dryness and itchiness. A study published in the Journal of the American Academy of Dermatology found that 74% of individuals with hypothyroidism experienced skin issues such as dryness, flaking, and itching. The skin becomes less efficient at renewing itself, leading to irritation. Women are far more likely than men to suffer from hypothyroidism-related skin conditions. Studies show that Black women often face more pronounced skin dryness due to the natural texture of their skin, which can already be more prone to dryness compared to white women. The delayed diagnosis of thyroid issues can make these symptoms more severe in Black women. To soothe dry, itchy skin, consider using natural moisturizers like coconut oil or shea butter. Both contain essential fatty acids that help lock in moisture and nourish the skin. But how does thyroid dysfunction lead to a heightened sensitivity to cold? Could Keisha's skin condition be linked to that as well? Number 10. Sensitivity to cold. Angela, a 45-year-old restaurant manager, began to notice she was always colder than everyone else, even when others felt comfortable. She would bundle up in extra layers, but nothing seemed to help. After consulting her doctor, Angela was diagnosed with hypothyroidism. The slow metabolism caused by her underactive thyroid was making it difficult for her body to regulate its internal temperature. Hypothyroidism can lead to a heightened sensitivity to cold because the thyroid hormones play a key role in regulating metabolism and energy production. When thyroid function is reduced, the body produces less heat, causing individuals to feel cold more often. According to a study in the Endocrine Society's journal, thyroid hormone deficiency can significantly reduce thermoregulation, leading to a constant feeling of cold, even in warm environments. Hypothyroidism-related cold sensitivity disproportionately affects women, especially those from minority communities who may have delayed diagnoses. Black women are more likely to experience prolonged symptoms due to delayed access to healthcare and disparities in diagnosis compared to white women, worsening the severity of cold sensitivity over time. To help manage sensitivity to cold, try drinking warm teas like ginger or turmeric, which are known to boost circulation and improve internal body heat. But what about cholesterol? Could thyroid issues also raise cholesterol levels, further complicating one's health? Let's find out next. Number 9. Increased cholesterol levels. Jessica, a 41-year-old real estate agent, was shocked when her doctor told her she had high cholesterol despite maintaining a healthy diet and exercising regularly. After more tests, she was diagnosed with hypothyroidism. The underactive thyroid was slowing down her metabolism and increasing her cholesterol levels. When thyroid hormone production is low, the body struggles to break down cholesterol, leading to higher levels in the blood. A study published in the Journal of Clinical Endocrinology and Metabolism showed that people with hypothyroidism often experience elevated LDL, bad cholesterol, which increases the risk of heart disease. Thyroid hormones help the liver process cholesterol, and without them, cholesterol can build up in the bloodstream. Black women are at a higher risk of developing high cholesterol linked to thyroid disorders compared to white women. According to research, Black women tend to receive diagnoses later, leading to prolonged periods of elevated cholesterol, which puts them at higher risk for heart-related complications. To help lower cholesterol naturally, incorporate fiber-rich foods like oatmeal and beans into your diet. These foods can help absorb excess cholesterol and promote heart health. But could thyroid issues also be behind heavy or irregular periods? Let's explore this in the next section. Number 8. Heavy or irregular periods. Alicia, a 35-year-old retail manager, had always experienced regular periods until she noticed her menstrual cycles becoming heavier and more irregular. After months of discomfort and excessive bleeding, she sought medical advice and was diagnosed with hypothyroidism. The imbalance of thyroid hormones was disrupting her reproductive system, leading to menstrual irregularities. Hypothyroidism can cause heavier and more frequent periods due to its influence on the body's hormone regulation. When thyroid hormone levels are too low, the balance of estrogen and progesterone is affected, leading to abnormal menstrual cycles. A study published in the journal Thyroid found that women with hypothyroidism were more likely to experience prolonged, heavy periods compared to those with normal thyroid function. This occurs because the thyroid helps regulate hormones that control the menstrual cycle. Women of color, particularly Black women, are more likely to experience severe menstrual symptoms due to delayed thyroid diagnoses compared to white women. Untreated thyroid dysfunction in these communities can lead to prolonged cycles, worsening the overall impact on reproductive health. To help regulate heavy periods, consider drinking red raspberry leaf tea, which is known to help tone the uterus and reduce menstrual bleeding. But how does thyroid dysfunction also affect digestion, leading to constipation? Let's explore that next. Number 7. Digestive problems like constipation. Tamika, a 40-year-old teacher, began noticing that her digestion was slowing down, leading to uncomfortable constipation that didn't improve with dietary changes. After consulting her doctor, she discovered her thyroid was underactive, and that was the cause of her sluggish digestion. Hypothyroidism affects digestion because low thyroid hormone levels slow down the body's metabolism, including the digestive tract. When the thyroid is not functioning properly, the muscles in the digestive tract contract more slowly, leading to constipation and bloating. A study published in the journal Digestive Diseases and Sciences found that constipation is one of the most common gastrointestinal symptoms in individuals with hypothyroidism. The slower the digestive process, the more difficult it becomes for the body to pass stool, leading to discomfort. Black women are more likely to experience prolonged symptoms of constipation related to thyroid disorders due to delayed diagnoses when compared to white women. Socioeconomic disparities often limit access to early diagnosis and treatment, exacerbating digestive issues like constipation over time. To improve digestion naturally, consider incorporating more fiber-rich foods such as apples and chia seeds into your diet. These foods can help stimulate digestion and alleviate constipation. Could this same thyroid issue lead to the development of goiter? Let's find out next. Number 6. Development of goiter. Sharon, a 48-year-old event planner, noticed a swelling at the base of her neck that seemed to get bigger over time. Concerned, she went to her doctor and learned that she had developed a goiter due to an underactive thyroid. The enlargement of her thyroid gland was a result of her body trying to compensate for its low hormone production. A goiter is an abnormal enlargement of the thyroid gland that can occur when the thyroid is not producing enough hormones. As the thyroid struggles to meet the body's needs, it grows in size, creating a visible lump in the neck. According to a study in The Lancet, iodine deficiency and hypothyroidism are leading causes of goiter worldwide. Without adequate thyroid hormone production, the gland tries to work harder, leading to the swelling. Women are more likely to develop goiters than men, and Black women, in particular, are at a higher risk of developing goiters due to delayed diagnosis and treatment of hypothyroidism compared to white women. This delay can lead to more severe and visible thyroid enlargement. To help prevent goiters, ensure your diet includes iodine-rich foods like seaweed and iodized salt, which support thyroid function and hormone production. But what happens when thyroid dysfunction affects the immune system? Let's explore frequent infections and poor immunity next. Number 5. Frequent infections and poor immunity. Kendra, a 34-year-old office manager, found herself getting sick more often than usual. She was frequently battling colds, infections, and fatigue. After multiple trips to the doctor, she was diagnosed with hypothyroidism. The low thyroid hormone levels were weakening her immune system, making her more susceptible to infections. Hypothyroidism affects the immune system because the thyroid hormone plays a role in regulating immune responses. When thyroid hormone levels are low, the body's ability to fight off infections diminishes. A study in a journal found that individuals with hypothyroidism are more likely to experience recurrent infections and slower recovery times. The thyroid helps regulate white blood cells, which are critical for defending the body against illness. Black women are more prone to delayed diagnoses of thyroid-related immune issues, which puts them at higher risk for frequent infections. Compared to white women, Black women often have a longer period of untreated hypothyroidism, allowing infections to take hold more frequently. To boost your immune system naturally, consider adding vitamin C-rich foods, such as oranges, strawberries, and bell peppers to your diet. These foods can help support immune function and aid in fighting off infections. But could thyroid issues also be behind changes in your voice? Let's explore voice changes and hoarseness next. Number 4, voice changes or hoarseness. Deborah, a 50-year-old school teacher, started to notice her voice becoming hoarse, even though she wasn't sick. Over time, the hoarseness worsened, making it difficult for her to speak clearly during long classroom hours. After a visit to her doctor, she was diagnosed with hypothyroidism. The thyroid gland's dysfunction was affecting her vocal cords, causing changes in her voice. Voice changes and hoarseness are common symptoms of hypothyroidism because the thyroid gland sits near the larynx, voice box. When the thyroid is underactive or enlarged, it can put pressure on the vocal cords, affecting the ability to speak normally. Research published in the Journal of Voice found that individuals with hypothyroidism often experience a hoarse, deeper voice due to thyroid swelling and reduced vocal cord function. Black women may experience more severe vocal changes compared to white women due to the later diagnosis of thyroid disorders. This can result in more noticeable and long-lasting hoarseness and voice alterations, especially in professions that require frequent speaking, like teaching or public speaking. To soothe hoarseness naturally, try sipping warm ginger tea with honey, which can help reduce inflammation around the vocal cords and soothe the throat. But could thyroid dysfunction also affect your vision? Let's explore how thyroid issues can lead to vision problems next. Number 3. Vision issues and eye swelling. Maria, a 46-year-old graphic designer, began experiencing blurred vision and noticed that her eyes were swelling. Concerned about her eyesight, she visited an ophthalmologist who discovered that her thyroid dysfunction was causing her vision problems. The swelling around her eyes was a direct result of her underactive thyroid. Hypothyroidism can lead to vision problems and eye swelling due to the buildup of fluids and tissues around the eyes. When thyroid hormone levels drop, the body's metabolic rate slows, leading to fluid retention that affects the eyes. This condition, known as thyroid eye disease, can cause symptoms such as puffiness, bulging eyes, and blurred vision. A study in the International Journal of Endocrinology found that hypothyroidism-related eye issues are more common in individuals who experience prolonged thyroid imbalances. Black women tend to experience more severe symptoms of hypothyroidism-related eye problems due to delayed diagnosis and treatment compared to white women. This can result in greater eye swelling and more pronounced vision impairment. To reduce eye swelling naturally, try placing cold compresses on the eyes or using cucumber slices to reduce inflammation and soothe puffiness. But how does thyroid dysfunction cause difficulty swallowing? Let's explore that next. Number 2, difficulty swallowing. Samantha, a 39-year-old marketing executive, started to notice that swallowing food was becoming increasingly difficult. What began as a mild discomfort turned into a persistent struggle every time she ate. After seeing her doctor, she learned that her thyroid gland was enlarged due to hypothyroidism, pressing on her esophagus and causing the swallowing issues. Hypothyroidism can cause difficulty swallowing because an underactive thyroid may enlarge, forming a goiter that presses against the throat. This pressure on the esophagus makes it harder to swallow, leading to discomfort or even pain while eating or drinking. A study in the American Journal of Medicine revealed that goiters caused by hypothyroidism are a significant cause of dysphagia, difficulty swallowing, in patients with thyroid disorders. The larger the thyroid grows, the more pressure it puts on the throat. Black women are more likely to experience delayed diagnosis of thyroid-related swallowing difficulties compared to white women. This delay can result in more pronounced symptoms, such as difficulty swallowing or choking, due to the thyroid's enlargement. To help ease swallowing discomfort, consider eating soft foods like soups and smoothies that require less effort to swallow and can reduce irritation to the throat. But could thyroid dysfunction also lower libido and affect sexual function? Let's dive into that next. Number 1, decreased libido and sexual dysfunction. Lauren, a 44-year-old business owner, noticed her interest in intimacy had decreased over the past few years. Along with her lowered libido, she experienced other symptoms of fatigue and mood swings. After seeking medical advice, she was diagnosed with hypothyroidism, which was affecting her sexual health. Hypothyroidism can significantly impact libido and sexual function due to the imbalance in hormones that regulate the reproductive system. Low thyroid hormone levels can cause a decrease in sex drive, mood instability, and even difficulties in sexual performance. A study in the Journal of Sexual Medicine found that both men and women with hypothyroidism often experience sexual dysfunction, including reduced libido and, for women, vaginal dryness. This happens because the thyroid hormones help maintain healthy levels of sex hormones such as estrogen and testosterone. Black women are more likely to experience untreated thyroid-related sexual health issues compared to white women due to delayed diagnoses. This can lead to prolonged periods of sexual dysfunction and a reduced quality of life. The hormonal imbalance often remains undetected, affecting not only intimacy but also emotional well-being. To help improve libido naturally, try incorporating foods rich in zinc like oysters and pumpkin seeds, which are known to boost sexual health. In this video, we've explored the serious impacts that thyroid dysfunction can have on women's health, from unexpected weight gain to decreased libido. It's clear that maintaining a healthy thyroid is crucial for overall well-being, and ignoring these signs can lead to long-term issues like infertility, osteoporosis, or even heart failure. If you've been experiencing any of these symptoms, it's important to consult a healthcare professional and have your thyroid levels checked. There are many natural and medical approaches to managing thyroid health, so early intervention can make a huge difference. Don't forget to share this video with your friends and loved ones. Make sure to click the white subscribe button, hit the thumbs up button, and share this information on your Facebook to help spread awareness about thyroid health and its importance. Thank you for watching NATURALdocTV.